I'm Dr. Liana Lianov. I'm the president and founder of the Global Positive Health Institute. Welcome to this podcast where we talk about all things related to positive psychology, positive health, and healthcare in general, how we can make changes for ourselves and for our patients. And so today I am delighted to have as our guest Dr. Ilona Boniwell. She is a professor of positive psychology at the University of East London and also CEO of Positran. And welcome, Ilona.
Thank you very much, Liana. I'm really delighted to be here and obviously to talk to you about these exciting questions. And thank you for inviting me here.
Delighted to have you. You are a luminary in the field of positive psychology. And just as before we got started on this call, and we were talking about how the field of positive psychology is fairly immense in some ways because it applies to organizations and education and many others areas besides health and healthcare. But there's a lot of overlap and there's a lot that we can learn from you within health fields and self-care. And so I'm really excited to jump in. And so first of all, tell us what first grabbed your attention to this field of positive psychology.
Okay, well, that actually was quite a while ago because I originally came across the field of positive psychology in 1999. So we're kind of talking nearly a quarter of a century soon. And I was still a student, undergraduate student of psychology. I was organizing a congress for students of psychology. I was looking for a topic, and somebody suggested the topic of positive psychology as the organizing topic for the congress. And I went, what's that? What this positive psychology thing is about? And the response was, well, that's really this scientific field that tries to understand what makes a life worth living. And that was it, really. I was sold from that very definition, from this very phrase. And I went, oh, that's so amazing. And almost a kind of a part of me going like, that's where I want to spend the whole of my professional life. And you know what? Nearly 25 years later, I'm still here with this field, within this field of positive psychology. And I'm still as excited now as I was then.
It's so great for the rest of us that you chose this path because you're contributing so much and such a leader. How do you tell us more about how you're using it professionally? And then I want to hear how you're using it personally.
Of course. Yes, in my work, I mean, I always try to specialize. I never succeeded, okay, to be perfectly honest. So in a sense, I'm actually doing quite a lot of different things in positive psychology. So one of my passions is positive psychology in higher education. So running a master's program, creating a master's program in positive psychology from 2007 originally, running lots of these programs, creating a PhD in positive psychology, running this PhD program, again, helping other organizations to create programs actually sort of using positive psychology. So kind of higher education in terms of creating and developing professionals in this field. That's one part of it, but also higher education in terms of bringing this knowledge to students in business schools, students sometimes in doing masters in health sciences, etc. So that's one part of it. And then other parts are even more practical, I would say. So because for a while, I mean, I just was an academic, like many academics, and sitting there in the ivory tower, being all excited about stuff, research questions and how to do great research. But then another part of me wanted really to sort of make a difference on the ground. And at some point, I faced the fact that I didn't know how to do it. So because I didn't know how to do it, I actually went and tried it. But that was many years ago now. So nowadays, I actually work in a lot of different organizations, actually bringing those positive psychology principles to organizations, to leadership, to consultancy, to reshaping how we run organizations, the principles, how we actually apply them on the ground. So one part of my work is organizational. Another part of my work is applying positive psychology to coaching and integrating it through bringing specific tools, kind of positive psychology informed tools to the field of coaching. And then the final part of my work is positive psychology in education, which is all about developing different programs around social and psychological skills for children, for teenagers, and teaching lots and lots of teachers as well how to use these programs, or sometimes the more toolbox type of approaches on the ground, again, developing social and emotional skills in our younger generations. So that's kind of a few things I'm doing.
Well, wonderful. I love that you are looking to also be grounded and make this very practical to a number of sectors of our society. And we've been working at the GPHI to do the same thing for self-care, healthcare. It's just like there's just wonderful research out there, but at the end of the day, we want to be able to implement it, apply it, and make a difference in people's lives. So thank you.
It's not just about research, it's about the how to practically do it. How do we do it? Let's say, imagine we know how to measure engagement and well-being. We know what contributes to engagement and well-being in the workplace, but how do we translate it to the day-to-day realities of work? Of course, we can introduce lots of seminars and training events, but that wouldn't necessarily make a difference if you, for example, don't integrate the strengths-based approach into daily management practices. If you don't bring positive emotions or meaning, for example, into how we recruit people or into how we give them feedback on a daily, weekly, yearly basis. So it's a question of how do we translate this great knowledge to something we do? How do we change our behavior? So I'm really passionate about behavior change on individual, and organizational level at the same time.
You just mentioned a couple of practical ways, the strengths-based, the meaning and purpose. Tell us a little more about these practical tools.
Oh, okay. Well, yeah, I'm really, really passionate about bringing it and translating it. So, for example, let's pick up any of the subject areas of positive psychology. So one of them, strengths. Strengths is, for example, a great tool. But again, it's something that usually people would just go and complete a VIA strengths inventory and they would just stop there. It actually doesn't make a difference, really. So if it does make a difference in terms of realizing your strengths, having this wow effect, being really excited you do have strengths, but usually most people stop here. But if you want to really align your life, for example, with strengths, it's not just about measuring them, okay? It's also about, for example, let's say in the workplace, integrating the strengths-based communication into job adverts, for example, so people become clear what strengths they're actually looking for when they are recruiting. It's about integrating strengths-based questions into interview questions, because we really want people, not just those people who have competence or skills, we want people who have strengths corresponding to the profession or the job that they're actually trying to hire for. It's about integrating strengths-based introductions to when people are introduced to one another. For example, a new recruit is arriving and, okay, this is Maria and she's going to be doing this, and you introduce Maria to 40 other people and she can't even remember them afterwards. But it's about actually getting people to introduce themselves from a strengths perspective and really spreading out those introductions so that the first encounter is completely different and really brings out the positive emotion. So it's about creating strengths introductions and facilitating them. It's about getting people to work on their strengths and being teams to work on their strengths and understanding whose strengths is where. And it's about, for example, applying and using the strengths approach to the concrete tasks people do in their jobs. So it's really about job crafting, but not necessarily on an individual level, but on a collective level. So we make sure, for example, that I'm aware of your strengths, you're aware of mine, and you're aware which tasks fit with my strengths and which tasks fit with your strengths. So we can actually potentially exchange some of our strengths as tasks to be more aligned with our strengths and to maximize this possibility that we're actually much more engaged in our work and fundamentally much less tired at the same time, etc. And can continue on and on and on and on. It's really about integrating kind of the nitty-gritty integration on a daily kind of lead level.
Terrific. I'm so glad you gave that example because we're now starting in lifestyle medicine and with some of our colleagues to talk about positive psychology constructs and character strengths does always come up, and people know about the VIA, and sometimes people know what their signature strengths are, but you're right, then it kind of stops there. We try to encourage them that you need to regularly use them, and even that doesn't go far enough. So you gave us some wonderful examples of taking it even further. So thank you for that. You probably then a great role model for us on how we use positive psychology in our personal lives. Can you share an example, and what are some of your favorite personal tools?
Well, I would say my favorite tools, if I look across positive psychology and health interventions, probably my two favorite tools is fundamentally walking, and being in nature. So, and this is something I really try to make sure I do very, very regularly, ideally on a daily basis. And it's not just the 10,000 steps, but actually beyond the 10,000 steps. And we do have a lot of evidence that walking together is extremely beneficial for our well-being, but we also have a lot of evidence that nature and encounter with nature, encounter with green spaces, being in the forest, walking by the river, etc., has a very positive effect on our well-being. So this is what I do try to do on a daily basis myself. And sometimes just, again, I'm busy as you are, terribly busy sometimes. So what I do try to do again is to integrate it in such a way that it becomes possible. So for example, I tend to do a lot of walking meetings, and sometimes walking meetings with somebody, for example, but also walking meetings with that. So which means I just walk out of the house when I have meetings. I say hello on my phone saying, hi, by the way, I'm having a walking meeting, and I continue the meeting whilst walking by the river. So it's called a walking meeting. So I'm with somebody in nature, integrating that also into my daily work. Obviously, when I'm teaching, it's a bit more difficult. When you have 30 people, 40 people in front of you on the screen, it's a bit more tricky. But individual meetings, that actually works very well. But again, I wouldn't stop here. I actually would, for example, like to highlight to the listeners that positive psychology has developed many interventions, many interventions. So it's not just a question of just using one. It's a question of being aware of them, and a question of kind of trying to integrate them. So for example, one of the things I'm using quite a lot, I've developed this positive action cards, which is really all the existing positive psychology interventions based on meta-analysis. So we know every single intervention here is something that has been analyzed, so went through meta-analysis, we know it's effective. And so sometimes it's just a question of kind of going through saying, okay, all the things we know we can do with lots and lots of these instructions. Okay, and so what corresponds to my mood today? What do I need? Do I need to act on my physical exercise side? Do I actually need to make an action corresponding to sort of a social aspect of my existence? And if so, what do I actually do? So it's having the awareness of what exercises are out there and integrating them again into daily lives. Because positive psychology interventions are not rocket science. It's something we all do anyway. It's just about kind of how to use them in a more conscious way,
intentional ways, and varying them based on the various needs and ups and downs that invariably life throws our way.
Exactly. And in our recent research, for example, with Larissa College, highlights the fact that people benefit from positive psychology interventions much more if they actually choose them. So there is a big role that autonomy specifically plays in positive psychology interventions. So it's kind of choosing what corresponds to your needs, and then actually the application becomes much more successful.
Yeah, that makes sense. And that's also takes the burden off if we're thinking, for example, of health practitioners that may be in the audience listening and thinking they might want to recommend this for their patients. They're like, whoa, I don't have the time to try and sit down, and because we encourage them to help the patient write a prescription, but how do we do that? But if the choice and the personalization lies with the patient, then that takes the burden off the provider and is actually more powerful. It's more the role of the provider to just say, hey, there's good science out there. Please take a look at it and maybe offer some resources, and then hopefully follow up with the patients and see what they're finding useful.
Absolutely. And for example, one of our studies, we actually specifically looked at patients. So the positive psychology interventions were proposed to patients with Ehlers-Danlos syndrome, for example. So people who actually do suffer from very much chronic condition and sometimes very sort of difficult, debilitating condition. And so we proposed those different PPIs, for psychology interventions, to them. And it is the group where people could actually really choose their interventions. They reported much less fatigue and increased life satisfaction and positive emotions 6 weeks later. So yes, absolutely. We can give the choice to the patients whilst using the base which has been empirically validated, but not necessarily having the responsibility of choosing interventions for them.
Mm-hmm. Mm-hmm. Yeah. Wonderful. I love this. This is just so concrete and doable. It's so exciting.
It is doable. Exactly. Thank you.
And so we've been talking about that provider-patient interaction. Do you have any other advice for health professionals out there in terms of using and maximizing what's available through positive psychology?
Yeah, I think a really important part that perhaps health practitioners want to be aware of is that positive psychology really enables us also to provide assessment and to offer assessment to see to what extent our patients have certain psychological resources that would enhance their well-being, that would enhance their resilience, for example, or that would be there to contribute to help them basically on their journey to behavior change. So I think a big part where positive psychology can really play a big role is to also enable this type of assessment, because we know there are certain personality profiles, there are certain personality characteristics which are much more conducive to behavior change. So how about measuring them? We can actually measure it. We know that resilience, for example, relies on many different psychological resources, not just one button to press. It's not just, for example, being lonely or in a relationship that would contribute, absolutely being in a relationship that would contribute to resilience, but we also can measure psychological flexibility, for example, as one of the resources around resilience. We can measure self-belief, we can measure flexible mindset, we can measure meaningfulness, etc. So we can measure the psychological, basically, background of our patients, and therefore, thanks to this assessment, which is then relatively easy to implement, we can know as sort of health professionals what can help us to accompany this patient. So I think this is a great role for positive psychology in the future as integrated into medical healthcare.
Yeah, that's what we've been thinking. I've been thinking a lot about, and we've been developing some tools for integrating elements of positive psychology throughout the healthcare visit, the healthcare encounter. And of course, in the beginning of the encounter, there is assessment, getting to know the patient, and we can certainly integrate some of these elements. Of course, that takes time, so we could perhaps do this online, do this in advance, create some nice, succinct dashboards that then the provider can look at and then have that conversation with the patient.
Absolutely. I've been working, for example, with one private healthcare provider focusing on positive aging and specifically developing this positive psychology-based assessment tools, which basically takes for patients about 15 minutes to complete, but that becomes a part of the assessment journey, and it is really important information for the health practitioner to then rely upon. And then, of course, there are other things sometimes much more even easy sometimes to implement. For example, one of the tools I've developed is this happiness dashboard, which is, for example, very simple, very simple. It's kind of, you can see this dashboard has been used by all patients. Very simple, one item type of scales, visual scales, very easy to understand, which enables, again, to grasp the level of well-being of our patients at the energy level, how they relate to their emotions, the time they have available or not, for example, overall satisfaction. And again, that can give us very concrete clues basically as to what we need to do and how. For example, if our patient is actually on the time balance variable, is indicating they maybe have about 5% of time for themselves, we know that's going to be much more tricky to integrate any sort of consistent behavior change, for example. And so we need to think to be thinking creatively rather than just simply prescribing, for example. So again, this can give us very concrete indicators, and so there are different levels of integrating either via assessments, of online type of assessment, or even in consultation.
Yeah. Wow. Well, I'm learning through this process. You're giving me some ideas, Ilona. So this is wonderful as we're trying to further develop tools.
Well, for example, just to add one
Yes.
more, there is a tool, little tool, you can see, developed by one of my students originally. And this is a tool which I find extremely useful, that it's called feeling magnets. It basically has lots of different feelings inside, and they're all magnetic, so you can attach them, etc. And this is a tool I find extremely useful in mental health and mental health prevention. So when you are, for example, working with patients who is depressed, who is anxious, etc., what we do know is very often patients who struggle with mental health really struggle with emotion labeling. So if you ask them how they feel, they'll tell you, oh, I'm not feeling great. And that's kind of it, end of story. And yet we know that our dealing with emotions, emotion processing, and actually starting to interact almost with our emotions also very much depends on our capacity to actually sort of perceive our emotions first and to give a precise name to them later. So it's a really important competence or skill to be developed. So this particular tool was developed by somebody who went through very severe burnout, fundamentally, who has collapsed. And she realized one day that she collapsed because she could never identify what emotions she was feeling. Her answer to anything will be, I'm feeling great, I'm feeling fine, without being able to differentiate the emotions. Therefore, the signals of the emotions were not there, in a sense, leading to the experience of burnout or mental health fatigue, etc. Obviously, burnout, there is a whole big debate as to where it's positioned in the field of medical diagnosis. So I'm coming from a slightly more psychological perspective here. So simple tools such as this basically enable patients to actually try to pinpoint and identify the emotions they're feeling, giving them the names, rather than just saying, okay, just try to think about what you're feeling. This is actually a concrete tool which accompanies a person in mental health distress throughout their difficulties, for example.
Well, and I think from what I know about psychology, psychiatry, is that having some acknowledgement of one's feelings can really make a big difference, even if we don't have an immediate solution. So what that tool is doing is it's fully acknowledging this is where you're at. And even if you have to sit with that pain, it's painful, but sitting with it and having someone else observe that and recognize, acknowledge that can be very healing.
Absolutely.
Yeah. I love it. I love it. Well, we've been talking about some tools and resources. What are some of your favorite books or other resources that our listeners might delve into if they want to learn more, since we have such a short podcast here?
Well, there's so many positive psychology books out there. It's a tricky question to answer. But probably one of my favorite recent ones is one book. If you're, for example, working either in organizations or with organizations, there is a great book called Lunchtime Learning for Leaders, written by Dr. Lucy Ryan, and which really integrates positive psychology and health psychology, I would say, lots and lots of health guidance in a very, I would say, user-friendly, but at the same time, intelligent way. So basically, if you are a leader or working with leaders, or if you are working with organizations, this is a really great book to start with. Another book, we talked about strength, for example. Another book I would highly recommend is this Your Strengths Blueprint by Michelle McKay and Ariel Lone. Again, if you are interested potentially in learning about strengths, but in a very applied fashion as well, sort of practical fashion, that could be a good book. And then, I probably could recommend some of my own books. So one of my favorite recent books, it's Positive Psychology Coaching in the Workplace. And this is, again, a very complete coaching, I would say, book. It's an edited volume by Wendy Ann Smith and Susie Green and myself. And basically, again, looking not just the workplace, just even outside the workplace, of how to integrate positive psychology into one-to-one helping by talking conversations. So even though a lot of it is about more executive coaching, a lot of many of these chapters can actually be applied to sort of one-to-one talking approaches, including in healthcare. And of course, Liana, we have a great book on positive health coming out very soon as well.
So
we can
exciting.
just about mention it, can we?
Yes, we do. We do the International Handbook on Positive Health that we're doing collaboratively, co-editing, also with Kieran O'Boyle and Yolanta Burke from RCSI, the Center for Positive Health Sciences, and Beth Frades, who's the current president of the American College of Lifestyle Medicine. And so looking forward to that. That's exciting.
Yeah. Absolutely. I think it's going to be, I mean, it is a great book. It's just at the moment we know it, nobody else does yet, but they will.
Yes, that's right. Wonderful. Yeah, and I should do a plug that next year we're also, Yolanta Burke and I are working on one that's specific to lifestyle medicine and positive psychology. So that's on its way as well. So there are new tools coming out, but there are also wonderful tools. And I actually really appreciate that you're coming from a different perspective, the non-healthcare perspective, but there is so much that can be applied in healthcare, and oftentimes we don't think that, and we need to be looking in the education sector, the human resources sector, and apply it for in health, self-care and healthcare. So wonderful. Well, we are about the end of our time because we like to keep these short. And before we end, do you have one final big piece of advice, one take-home message for our listeners about how to pull all this together, this beautiful field of positive psychology for health, well-being, and beyond?
I would say that I think the difficulty sometimes of the integration between our fields relates to the fact that what positive psychology in a sense prescribes are the type of interventions which are long interventions, or they take time, they take space, they take discussions. And I think what really healthcare providers and what practitioners are dealing with is very short consultation times where you have to really grasp so much about the patients whilst not necessarily having any more time to add more to this consultation. So I think that's one of the difficulties, is how to find, this is all great, but how do you find the time? Mm-hmm. And so what we are doing in the field of education currently is that actually teachers are faced with very similar problems, slightly different, because they're faced with big classes and again, very little time to bring anything extra. And so we've been working very extensively to develop a more toolkit approach for teachers kind of to draw on flexibly. And I think this is something that can apply to healthcare practitioners. I think it's a question of taking what we know from the field of positive psychology and translating in such a way that it becomes short, workable, and impactful. And I think this is where the next task lies. And I think, Liana, is what you're already extremely passionate about, is translating it to something that health practitioners can really use. Sometimes it's not about recommending an intervention. Sometimes it's simply about changing the way you ask a question or changing a phrase to actually bring some of those messages fundamentally, rather than integrating that big sort of solution, which is probably impossible in your current working life. So I think I probably would like to stop here.
I love it. I love it, because that's what I'm passionate about. So that's a perfect way to end on a high note. Thank you, Ilona Boniwell, for being our guest on this podcast. Maybe we'll get a chance to bring you back again sometime. And thank you to our listeners of this GPHI podcast. And please take a look at some of our other offerings. Please subscribe to our channel, and hope to see you again on one of these podcasts. In the meantime, be safe, be well, and be happy. Take care, everyone. Bye-bye.
Thank you very much. Thank you. Thank you, Liana. Take care.